Florence Nightingale, 1820–1910, known as the Lady with the Lamp, was a British nurse, social reformer and statistician best known as the founder of modern nursing. Her efforts to reform healthcare greatly influenced the quality of care in the 19th and 20th centuries. Florence Nightingale was born on May 12, 1820, in Florence, Italy. Florence was raised on the family estate at Lea Hurst, where her father provided her with a classical education, including studies in German, French and Italian. From a very young age, Florence Nightingale was active in philanthropy, ministering to the ill and poor people in the village neighboring her family's estate. By the time she was 16 years old, it was clear to her that nursing was her calling. She believed it to be her divine purpose. When Nightingale approached her parents and told them about her ambitions to become a nurse, they were not pleased. Determined to pursue her true calling despite her parents' objections, in 1844, Nightingale enrolled as a nursing student at the Lutheran Hospital of Pastor Fleidner in Kaiserwerth, Germany. In the early 1850s, Nightingale was promoted to the superintendent within just a year. When cholera disease spread rapidly, Nightingale made it her mission to improve hygiene practices, significantly lowering the death rate at the hospital in the process. In October of 1853, the Crimean War broke out. Nightingale came to prominence while serving as a manager and trainer of nurses during the Crimean War, in which she organized care for wounded soldiers at Constantinople. More soldiers were dying from infectious diseases like typhoid and cholera than from injuries incurred in battle. She significantly reduced death rates by improving hygiene and living standards. Nightingale gave nursing a favorable reputation and became an icon of Victorian culture, especially in the persona of the Lady with the Lamp, making rounds of wounded soldiers at night. Others simply called her the Angel of Crimea. Nightingale created a number of patient services that contributed to improving the quality of their hospital stay. She instituted the creation of an invalid's kitchen, where appealing food for patients with special dietary requirements was cooked. She established a laundry so that patients would have clean linens. She also instituted a classroom and a library for patients' intellectual stimulation and entertainment. The Queen rewarded Nightingale's work by presenting her with an engraved brooch that came to be known as the Nightingale Jewel, and by granting her a prize of $250,000 from the British government. In 1860, she decided to use the money for funding the establishment of St. Thomas Hospital, and within it, the Nightingale Training School for Nurses. With the support of Queen Victoria, Nightingale created a royal commission into the health of the army. She became the first female member of the Royal Statistical Society and was named an honorary member of the American Statistical Association. Throughout the U.S. Civil War, she was frequently consulted about how to best manage field hospitals. In August 1910, Florence Nightingale fell ill. She died unexpectedly on Saturday, August 13, 1910. The Lady with the Lamp was laid to rest in Hampshire, England. Florence Nightingale is broadly acknowledged and revered as the pioneer of modern nursing. Since 1965, International Nurses Day has been celebrated on her birthday, the 12th of May, each year. The President of India honors nursing professionals with the National Florence Nightingale Award every year on International Nurses Day. Nightingale was a pioneer in statistics. She represented her analysis in graphical forms to ease drawing conclusions and actionables from data. She is famous for usage of the polar area diagram, also called the Nightingale-Rose diagram, equivalent to a modern circular histogram. This diagram is still regularly used in data visualization. Thanks for watching.